to 8 p.m. last night, there were just over 95,000 tests done in New South Wales, and it's really important, as we always say, to keep those testing rates high. To 8 p.m. yesterday, there were 262 cases of community transmission, with at least 50 of those infectious in the community during that time. And as we've seen in the last few days, the numbers are bouncing around a bit, but clearly we need to reduce those numbers. And I urge everybody to please stick to the rules, follow the health advice, and only leave home if you absolutely have to. Unfortunately, overnight there was one death of a woman in her 80s who was not vaccinated, and Dr McAnulty will provide further information about that. In relation to the virus, Canterbury-Bankstown local government area still remains the epicentre of the most cases. Obviously, all local government suburbs within the Canterbury-Bankstown area and adjoining areas are under risk of transmission. It's again creating the highest number of cases, and as Deputy Commissioner Warboys will outline, that has been the focus also of police compliance with extra presence on the ground, making sure people are doing the right thing. On a more positive note, health experts advise us that if people in the Georges River local government area come forward for higher rates of testing in the next few days, that local government area is likely to be taken out of an area of concern. So can I please urge everybody who lives in the Georges River local government area, especially in those suburbs adjoining the local government areas of concern, please come out and get tested if you have the mildest of symptoms. That will give the health experts confidence to take the Georges River local government area out of those areas of concern. And congratulations to people in that area who've been following the advice, doing the right thing, and have seen a reduction in the number of cases. Regrettably, however, there are 12 suburbs in the Penrith local government area that will be now listed as an area of concern and will be subjected to those harsher restrictions that we've imposed on those 8 local government areas. Dr McAnulty will read what those 12 suburbs are, but they're clearly suburbs that are boundaries to those other 8 local government areas. And we want to make sure that we stem the tide of the virus seeping into those additional communities. And as I said, Dr McAnulty will read what those 12 suburbs are, and we ask residents from 5 o'clock this afternoon to adhere to the additional restrictions placed upon them. Pleasingly, New South Wales now has made sure that there are 4.4 million jabs in arms. Now that is positive. We're doing really well in terms of increasing the number of people getting vaccinated every day. And can I urge everybody who hasn't had at least one dose of the vaccine to come forward and get vaccinated. Every adult should be coming forward and getting vaccinated, and we urge everybody to please do that. As you all know, in Homebush today, we're focusing on any worker who works in supermarkets or face-to-face food retail. There are thousands of people who've already booked to come in and get their jab today, but it's also allowable for people to walk in today. If you want a jab, especially if you work in frontline food services, please come forward today to Homebush and get a jab. The vaccination centre there is open till 4 p.m. And whilst we do have a couple of thousand bookings already, there is capacity for people to come forward. It's a rainy day. If you don't have symptoms and you're not in isolation, you're not a close contact, and you're not someone of concern, please come forward and get the jab. Can I also stress again how important it is for us to fight this outbreak through the lockdown, through everybody doing the right thing, but also through getting vaccinated. And they are the 2 tools we have to reduce the case numbers and look forward to a future which has fewer restrictions. And I really, really urge everybody to stay at home unless they absolutely have to. And secondly, of course, come forward and get the jab if they haven't.